Hi, good morning. So today we are here, we'll show you how to do a treatment with Morpheus8. So this is the machine, Morpheus8. Basically, Morpheus8 is a technology that combines microneedling with RF energy. So both the things, they lead to skin tightening. Microneedling, this is the handpiece for Morpheus, the cartridge. So when we press the foot switch, needles come out of the cartridge. So this is a 24 needle cartridge. So when we give a shot, the needles penetrate into the skin, as a result of which we are creating micro injuries into the skin. Plus the needles are giving radio frequency energy, or you can say a kind of heat energy. So both of these lead to rebuilding and remodeling of the collagen. As we all know, after the age of 25 years, the collagen production and collagen building, it decreases because of the aging effect. So these are the changes which start with aging, and the cell turnover rate also starts decreasing after the age of 25 years. So nowadays everybody has become very aware that we should start all the anti-aging treatments just at the age of 25 to 30 years. So this treatment, it helps to tighten your skin, as well as it reduces the fine lines, wrinkle, and leads to skin rejuvenation. So the benefit of Morpheus8 is it can be used in various conditions, whether you have open pores or you have fine lines, or there are acne scars or scars because of any condition, or you have pigmentation, or you have any loose skin. So this takes care of everything. Plus it will give a radiance to your skin, improve the complexion, uneven skin tone can be improved. So all these conditions we can use Morpheus8. So we have this different parameters in the Morpheus8. So for the face we always use 24 needles a cartridge, but we can go a depth of 1 to 4 mm. So we can do the treatment at 1 mm, 2 mm, 3 until 4 mm. So we can change the settings from here. This is the depth of the needles. We can give the energy, we can increase the energy, and we can use a cyclic mode or a fixed mode depending upon the indication for which we are doing Morpheus8. So this is the biggest advantage of Morpheus8, that we can go to any depth of the skin we want, 1 to 4 mm. With the dermapen, the depth is limited, we cannot go so deep. Suppose any patient is coming to us for double chin, he has fat and loose skin under the chin, so we can go till a depth of 3 mm, 4 mm, and we can target the fat in the under chin area. So it's a very popular treatment nowadays.
This is a microneedling, but the best form of microneedling, because we can set the parameters and depth. And second main thing is it has radio frequency. So radio frequency is for the skin tightening. So needles, they penetrate inside and give the radio frequency energy, or basically it is a heat. So then there will be coagulation of a protein in the skin that will lead to tightening over next 1 month. So this is very sought after treatment. So we can set the depth of the needle, that is very important, because there is a bone and a thin skin on the forehead, but there is a thicker skin on the cheek. So for the forehead we do the superficial level, say at 1 mm, and for the cheeks we can give 2 passes at 2 mm and 1 mm. So there are deeper depths also, we can go to 3 mm or 4 mm, but that is very dangerous, because that will coagulate the fat also. So there is a fat below the skin. So our target is not fat. If any doctor who is doing a deeper treatment and coagulating the fat is wrong, because we need fat in the face. We do a lot of treatments in which we do fat grafting, we add the fat. So fat is very good for the face. So our aim is the skin, which is very thin, just 1 millimeter, or maximum we go up to the depth of 2 millimeters. So there is collagen, that is the protein in the lower part of the skin, that is the dermis. So lower part is of the skin is dermis, so there are collagen fibers. So we are going to hit the collagen fibers and we are going to create the injury. So whenever there is an injury, suppose you are going to gym, what you are doing, you are injuring your muscles. So when you rest, you come back from the gym, the muscle will grow. So first we have to give injury, then there is a repair, and there is new building blocks in our body. So similarly in the skin, all the treatments are aimed at the collagen in the skin, and we do the injury. That is a very specifically scientifically proved treatment, and then the collagen fibers will arrange and they will be more tighter when they will regrow. This is the PRP we have already prepared from his own blood sample. So this is again, I'll show you in another video what are the uses of the PRP.
So I'm going to start. Okay, comfortable?
Yes.
Yeah. Can you feel the needles?
Yes.
Yeah. So we can always change the energy. If you feel a little uncomfortable, I can reduce the energy.
See, we don't have to be always very aggressive in the treatment. So this is my personal experience. Sometimes we do more energies aiming that the result will be better. No. So there is a optimal energy. So there is a optimal speed to drive a vehicle. So similarly, there is a optimal energy. So two things. One is the depth, that is 1 to 2 millimeters. Second is energy in joules. So we have to decide whether to give 20, 24, 28. So we have to give very optimal energy, and this is the experience. We have to decide according to the skin of the client, according to the downtime he or she wants, and the results and the number of sessions the person is opting.
The benefit of Morpheus8 is we can do it in all skin types, whether the complexion is dark, light, and there is no downtime. So the redness remains just for 2 to 3 hours or maximum 1 day. So we can do the tightening in any kind of skin, any kind.
So as a plastic surgeon, I will answer that if I get a patient who's very old, there are static wrinkles, so in that case there is no role of Morpheus. Don't expect that if your age is 50 years you are getting Morpheus done. So because the doctor will use more energy to treat the deep wrinkles, so that can be harmful also, that can coagulate your fat also in the older age. So I don't opt for the Morpheus because there are surgical procedures which I can do to lift the face, or whenever there is a loose skin we can do certain surgical procedures also. So there are many patients who are in the age of 60 years or 50 years, they come and they ask for the non-surgical treatment, but that is wrong. You don't ask for always for the non-surgical treatment. So this treatment or any non-surgical treatment is mostly aimed for the younger age group. You start from the age of 30 years till 45. So this is the ideal age group for the non-surgical treatment or for the Morpheus treatment.
The most important aftercare is that the patient has to avoid sun exposure because the skin is already injured, it's inflamed. So we don't want the harmful UV rays to penetrate the skin and cause further damage. And other precautions, what are the don'ts after the procedure? He should not use any active ingredients like vitamin C, AHAs, BHAs or retinol for the next 5 to 6 days. No sun exposure, and there should be no rubbing of the skin, no steam, sauna, spa or swimming. Avoid all these activities. If it is possible, he or she should avoid gymming also for 2 to 3 days because gymming causes excessive sweating and there may be some irritation or itching of the skin.